fiscal year 2022 increased millage rate to 21.
Approve increase of millage rate from 20.25 to 21.
Anyone? All in favor?
Aye.
All right. Board chair votes aye, so our millage rate is now approved. Thank you, guys. All right, so the next,
Did you close this meeting?
we have to close, yeah. We are closing this meeting on the draft hearing, June 22nd at 6:31. And we will be starting our board work session, June 22nd at 6:31 p.m. We are calling to order our work session for the evening. Thank you again for all who are joining us. We have all board members present, as well as the superintendent and Shayna. Let's see, so the first thing we'll do is call that to order, and we will approve the agenda. Did anyone have any corrections or adjustments to the agenda?
I was just going to recommend we move the class ranking presentation first so that Dr. Jones can share her presentation and then continue with her evening.
Are you guys okay with that? Sure. Move that up to first item on the agenda. And so did you want to move that above the calendar? We'll go ahead and start with that. Okay, so let's start with the class ranking first.
Dana, will you let Dr. Jones in? She's in the attendees.
Hello.
Hey, Dr. Jones, I am going to share my screen and run your presentation unless you want to share it.
No, that's fine. Whichever's easier.
Okay. Shayna, I can't share my screen. You'll have to share it. Oh, yes.
Anybody want anything?
We are ready for you. If you just want to let me know when you're ready for me to go to the next slide.
Yeah.
Oh, we can't
All
hear you.
right. That was my 18-year-old checking in on me. So we wanted to start with, first of all, good evening. Thank you for having me. We wanted to start with just a basic definition of class rank. Class rank is essentially based on grade point average. The student with the highest GPA in a particular graduation cohort, which is defined by the graduation year for all students entering ninth grade in a particular year. So the rising ninth grade class would be the class of 2025. So that would be their cohort. So the student with the highest GPA has the rank of number 1. The student with the lowest GPA has the rank of whatever that total number is. If there were 527 students in the class, the student with the lowest GPA would be ranked 527. Next slide, please. So how we calculate class rank is basically, how do we calculate GPA? So it is a cumulative weighted GPA, everything that students have taken starting in ninth grade, which actually starts as soon as they're promoted to the ninth grade from Renfro, or whatever middle school they attended if they are transferring in. So everything from 9th through 12th, 1 point of weight is added, and we call that the 1 point bump. If a student passes a course that is advanced placement, dual enrollment, or an international baccalaureate class. So if I make an A in one of these 3 types of classes, rather than 4 points being added into my GPA, 5 points will be added into that GPA calculation. The current use for the rank is to determine who our Val and Sal and junior marshals are. The valedictorian is the person who is ranked number 1. Salutatorian is the person who is ranked number 2. Junior marshals, there's typically 3 or 4, depending on whether or not there's a tie. And that's what we use those ranks for, nothing else. Next slide. Thank you. So the question that people always ask is, we need that to determine Val, Sal, junior marshals. Does anybody else need this information? Honestly, no. The first thing colleges ask us is, what classes did the student take? Second thing they ask, what grades did they make in the classes that they took? Those are the 2 most important pieces of information. The third piece would be SAT or ACT scores in a year where they actually count. Some colleges will ask if the school ranks, and if so, how. Ours is exact currently, but there's exact, decile, quartile, percentile. They will then ask, Common Application and a few others, if you do rank, what is the rank of the top GPA in that particular class? For a school or agency that the rank matters, that is what's more important than what is their actual rank, is how close is this student to whoever has the top rank? Because that exact number rank doesn't necessarily tell you that piece of information. And we'll see that on the next slide. So what we have here is for some sample years, how the ranks pan out. And this kind of shows you why just given that number doesn't give the whole picture. And we tend to think that this at times could be disadvantageous to students. So for this particular class, and I've taken out all the information that would tell you who the student is or what the graduating class was. If you look at the first few lines, you'll see there's a clear number 1. There are 3 students tied for number 2. The actual third highest GPA, you would think that student would be number 3. That student is 5th, has the rank of GPAs. They're 5th because they're the 5th student. We couldn't make them 3 because that would then throw the list off. If there were 527 students, now the last person would be 524 instead of 527. It doesn't appear to matter much when, oh, they're 5th and they're really the 3rd GPA. But if you scroll down a bit further, that's good. When I actually have the 78th highest GPA, but I have to tell them I'm 105th, that doesn't necessarily feel good for us to be able to have to say. If you go to sample B, you'll see some of those same dynamics. And this is where we get into is it advantageous or disadvantageous to give this information? I'm actually the 35th highest GPA, but my rank is 60. And I know you all have access to this presentation, so you can look through some of these. And like I was saying, oops, I'm sorry. Some of the colleges will say, how far am I from the highest? It looks better to say the number 1 student has a 4.8 and I have a 4.5 than to say I'm 100th in the class. So what is currently going on with class ranking? We've got lots of articles. We did lots of research. Roughly half of the schools in the country are not reporting class rank. They have found it to be potentially disadvantageous to students. They see how it is playing negatively on students' social, emotional, and mental health. And when you look at, does it really matter for college admissions? As with anything college related, it depends on who you ask. But what we do know is this: if the information is not supplied, it does not hurt the students' chances of admissions. If the information is supplied, a college may or may not use that information, and we have no say in how they use it. Next slide. So lots of articles. I've given a small sample set from various agencies. We have Psychology Today and psychologists that have done research on how it impacts the student emotional health, not just the announcing of the information, but the psychosocial interplay between students and the less than healthy competition, competitive positions that it's putting students in. The National Association of Secondary School Principals put out some guidance and recommendations as well. And the last sample I have on here is a teenager from Williamson County, Texas, who made a short film about the basically dramatizing the mental health impact of the competitive nature of class ranking and how students interact with each other relative to that race to be number one. Next slide, please. So what we're seeing with our high school students. It's good to hear about what's going on around the world, around the local metro area, but what's happening with our kids. We're seeing unhealthy levels of competition. We're seeing students that are gaming the system by taking certain courses just for the sake of padding their GPAs for rank. So rather than taking a course because I'm interested in AP environmental science, or because I want to be a chemist, or I am going to a school that needs me to have the IB diploma. They're taking those classes because they have the grade bump, and that's going to benefit them in their race to be number one. Even though it is communicated at the beginning, at the end, and throughout the year that we adjust class rank in January and in June only, every 6 weeks when a progress report comes out, counselor emails are bombarded from students and parents asking, what is my rank now? Has my student's rank changed? And it is, it's beginning to feel like that's more of the emphasis, not what has my student learned? Are they falling behind? How can I help? It's where are they in this race to the top? We have students, like I said, electing to take certain classes, but also electing to not take classes because they may not have a bump. So when we moved from AP chemistry to advanced chemistry, we had students elect, even though they had plans to be in the medical field or engineering or STEM related fields, we had students that would elect not to take the advanced chemistry course because it didn't have the bump that the AP chemistry course had. And now that we have the IB chemistry course, there are some students that are like, oh, cool, it's got the bump again. Next slide. So I connected with counselors through the American School Counseling Association, the Georgia School Counseling Association, through emailing district leads and head counselors at various schools across the metro area to kind of get an idea about what folks are actually doing. The majority of the school systems in the metro area do not report rank. APS and Gwinnett are the two that do. And then you can see here the other schools around the country that do not report rank. So the last year that we included rank on transcripts for Decatur High School was with this last class of 2021. And we will not be including rank on transcripts going forward. If there is a school, a scholarship, or something like that that asks specifically for a rank, we can get permission to do that from the student, from the family, but it will not be something that we broadcast. It's not like we broadcast it now, but students see them and they share, I'm number one, I'm number two, what rank are you? We will not have those things on transcripts anymore. Last slide. The theme with the background of this presentation, the sky remains the limit for our learners, and not reporting class rank does not make our student skies fall. And that is the end of the presentation.
Thank you, Dr. Jones. Appreciate that.
You're welcome.
Are there any questions or discussion from the board? Ms. Lostrand is also on. If
Yes.
We have any questions for the principal as well.
Well, I was just wondering, in this discussion, so are we also considering, I know that in the presentation, that it said that up for consideration was removing the valedictorian and salutatorian and junior marshal. Are we having that discussion now also?
Dr.
That's something for later.
Go ahead.
Okay.
Did you have a comment or input about it? I mean, go ahead.
So if today we recommend that we do away with class rank, there's still a possibility that there will still be a salutatorian and valedictorian using class rank?
So
after this.
that's what's up for discussion, because there's lots of school districts and schools that use a variety of methods for the valedictorian. By definition, the valedictorian is simply the last person to speak at the ceremony. So it's not really tied to GPA. That's kind of an American thing. So there are schools that have the senior class vote for the valedictorian, who gives that address at the ceremony. There's some that have it being a faculty staff type vote based on particular criteria. So all of that is still up for discussion, but I didn't want to mix the two. This was just the class rank piece this time.
And just for clarification, because the board, the class rank is not a board policy decision, it's just, this is the recommendation that the high school team made. I support that decision, and just if you have any questions about it, and also so you're aware of it as we go forward.
I have a comment, so I think it's fine that it's not our decision, but I do think that this is a good decision, and I strongly support it, and would also strongly support using a different means to select the salutatorian and the valedictorian. And when you talk about the stress and the competition, I think an awful lot of that is actually focused on those top slots. And I think that it's an unhealthy competition, it's an unhealthy focus, and it's a poor indicator of who's the top student. I can't think of any good reason actually to keep the valedictorian. I mean, I think more often than not, your valedictorian is not necessarily the best student because of weird policies that come in, like some student took advanced physics at Georgia Tech and they didn't get the bump. So the student who, I can speak from personal experience on this, the student who is the top student is not actually, you know, in most respects, the top student. And so shorts things, it's unhealthy for everybody involved. I support not doing it that way. Not just eliminating class rank on transcripts, but using a different method, some kind of method to figure out who could give a good address, because that's the only function, rather than who gets the highest numbers. The other thing I'd say, a couple of years ago, I was talking with an acquaintance who happened to be an admissions officer for a very highly selective college, and I asked him, how do we do in terms of our graduates, you know? And he said, well, Decatur's great, we know Decatur, so that's good. But he said the number one thing that you could do to give your students a leg up, eliminate class rank, get it off the transcript. It doesn't help anybody. And, you know, if half the schools in the country are using class rank, he said the better schools don't do it. And so it's actually kind of a mark of distinction not to have it on your transcript. And if you look at the private schools around town, they're not reporting class rank. It really just doesn't help. We don't look at it. And really, you would do your students a favor, eliminate. So I think this is good, and I appreciate the work that you put into making this.
Thanks.
I'll also comment, just I think it's a good decision and I support it. It eliminates unhealthy anxiety and, you know, self-evaluation on the wrong ground. And it's much more important, I think, for students to work hard, do their best, get good grades, take the appropriate classes, challenge themselves. And so I, you know, especially because it doesn't seem to have a negative impact to eliminate it, I think it's a good decision. And I think it'll be interesting to hear the conversation about how we may decide to determine the speakers at graduation in the future. Maybe even doing away with the words and the terms, valedictorian and salutatorian, for our classes, since it wouldn't match what would be traditionally understood it to mean. But it will be an interesting conversation, and there's certainly a good way to choose a dynamic speaker that would represent the senior class, that would be supported by the students. Look forward to that hearing.
Yeah.
Thank you for your work to move this forward. I know it's been a conversation for several years, and so I think it's really great that we actually have moved it to this point and that we're taking action on it. So thank you.
Any other board comments?
I was going to ask about if a student requested it for scholarships or military or other things. And I think it's thorough and the right decision for what it's worth.
So much for your presentation. That will conclude this part of our agenda.
Thank you
Moving
so much,
on.
Dr. Jones. Thank you, Principal Lobster. Appreciate you guys being here. Good work.
And I just want to say Dr. Jones did all of the work on this. And so thanks publicly to her for making this a priority for our kids.
You're welcome. My pleasure. Bye-bye.
Also, our contracted volunteered your time to present tonight.
Wow, thank you.
Okay, so let's just jump through the agenda. The next topic, this is information for the board. And if you will discuss tonight, and if we want to take action, then we can take action at the July 13th board meeting. But I've sent a survey out to our families and to our teachers about a couple options for changes to the calendar for 2021-22. And the two options were to add early release days to hold parent conferences. And the other option was to add designated digital learning days. After reviewing all the input, favorable input from our parents, from our teachers on providing some dedicated time for parent-teacher conferences. So I am going to recommend that the board consider adding 2 sets of early release days. They would be the Thursday and Fridays that precede our fall break and winter break. We are going to provide enhanced daycare options or after-school options for any staff or parents that can't get there at the earlier dismissal time, so that that is not a burden on our families. And the early release time would be solely to hold parent-teacher conferences. So what the schools would do on that Thursday, they would work extended hours so that they could meet with parents after normal working hours to accommodate those parents who can't get off of work. And then the next Friday before the break, the teachers would close early and be able to leave with their students. So they'd have that jump start on their weekend right before vacation. That was a very positive, not just from the teachers, but from parents as well. And our staff also felt like it would cut down on absences those couple days before break, because people would feel like they could go ahead and stay and still get out early to start their travel plans. But that was just anecdotal from the teachers. Go ahead.
It's going to result in more people. If I have a half day before a week off, I'm not showing up.
Okay.
And I think I'm not the only one.
Okay.
I guess we'll see.
Yeah, we'll see. Well, we'll see if it's approved. So, the other recommended change was digital learning days, or not recommended change, but the option that had very unfavorable, perception from our parents. I think after a pandemic, understandably so. So I'm not recommending that we do the designated digital learning days for, the next school year. I think it's something we can revisit as we go forward. The thought with the designated digital learning days was that it would help make sure our teachers were keeping up with the online learning platforms, so that if something happens and we had to revert to full online learning, we were ready to make that change seamlessly. But I feel confident with just the use of Google Classroom that we'll keep that prowess up with our teachers. So that is one recommended change. And then the other recommended change is to add an observation day for Juneteenth. Next school year, it's always on June 19th, but that is a Sunday. So my recommendation would be that we close offices on the Monday after, which would be June 20th, in observance of Juneteenth. And then we would have to add a day, because if we're taking a day out, we'd have to add a day. So we would just add that to that June 24th calendar for 225 workers. People above that and above. So any questions, or what's the discussion from the board? And then if we want to move it for an action item, we can do that. If not, it just dies here.
I have a question.
Yes.
Totally procedural, which is that we have in our, changes to the calendar tend to have unexpected hornet's nests beneath them, right? And so we have some policies about adopting calendars 2 years in advance and all that stuff. I don't actually remember what procedures are, but are we departing from our procedures by making these changes at this time?
No.
We're not?
No. Changes at any time. We adopt the full calendar, but if we need to make a change to adjust for something, we can do that.
So the idea is that we've got the change with all the input in place, and these are just minor tweaks. And so, should we put it out for comment beyond the teacher, beyond the staff?
I did already, yeah.
So we've got comment from the public at large? Good.
Over 300 people responded to the survey. So it's a pretty good response.
I'm curious, for the staff who work the 225 days and above, what was their feedback on taking that day in observance of Juneteenth and then adding a work day, June 24th? How does that impact them, and what was their feedback on that?
That is a question I didn't ask. I didn't ask the staff that question, which I can if we want to get that information before the board takes action on this.
I generally support the observance of Juneteenth. I'm just trying to understand, if we add that day on June 24th, does that mean that their time off is shorter, the contiguous time off is shorter?
Yes, that would.
I'm just wondering if that is how the staff feels about that.
I'm not sure if this has come up in discussion or not, but if there's a situation where, say, a child has to be home for a week, not necessarily COVID related, but, just can't come into school for whatever reason, will we have digital options available for those? Would they, kind of veer off into the virtual academy space, or would we just maybe have virtual options for that particular class?
So I put three, because I agree. I think we need to have seamless instruction for kids that have an extended absence for an illness, whether it's the flu or COVID or, you know,
Broke
they've
their
had a
leg or,
broken leg.
yeah.
So we have put out there kind of quarantine learning options for next year, 3 of them, and I will be presenting at the July board meeting which ones we select. I still need a little more feedback on some of the options. We put out some options for parents to consider as well as staff, and I need a little more feedback from the staff before I recommend which option we'll use. But plugging into Virtual Academy is one option, concurrent teaching is another option, and a third option is that the teachers collaborate together, create lessons that complement or pretty much are what they're teaching in their classrooms. And then instead of me always having to do that for my class, I collaborate with, let's say, all 5th grade teachers, and the first week of the month is my responsibility to post the lessons and get the things up for any students that may be absent so they can keep pace. And then the other option with that is that there are some kind of virtual office hours for the teacher to provide some of that learning, that in-person, face-to-face learning, even though the student may be at home.
So that would include homebound students.
One more process question. So I'm totally fine with this. But I feel like at one time we had this thing where we would adopt it twice, like what we would do is kind of like a first reading, second reading. So at one meeting we would say, good, but that meant another public comment period. We didn't really do anything in 30 days in between, except people had noticed that they should come comment or talk about it or something like that. Again, I don't remember what we do. I don't know how much good that did. But I just know that we've been bit by schedule changes every time we make them. Yeah. Whatever we put in the policy is what we should follow. So if we're following the policy.
I mean, and sometimes you have to make changes to the calendar because of emergencies,
Sure.
and that's kind of, not that this falls under that for Juneteenth, but it definitely is one of those where it kind of came up. It makes sense to try to incorporate it right now.
I'm fine. I think it's all good. I just
I do have one question. It has to do with, it's related to what Tasha was asking about being able to fall back on virtual learning. What about when we have things like power outages in the school, or like we've had water main breaks in DeKalb County and not been able to have school, or if we have a, weather-related something, or for any reason, would have normally canceled school. Is there, like this year, when that happened, it was sort of business as usual because we were virtual anyway. Are we planning to continue that and kind of take advantage of our ability to continue instruction, or are we planning to have no school days?
I like that option. I think it makes sense. It continues learning. Then we don't have to make the days up later if we want to stick with 180 days. I know teachers and students feel a little differently about that. They want the day off. So I don't have a recommendation of that yet, but that would be my leaning. But, I'd like to get input from everyone before we make that decision.
I think as a board, we should prohibit taking a snow day and turning it into a virtual one. It should be like the value of the system.
You would get support on that.
But in seriousness, I would worry a little bit that if you're doing it without notice, that the kids who aren't wired already, and we were already wired because they're already doing virtual, but if they're not already hooked up, then you have a water main break, you're not going to have the day or the week that you need to make sure they got hot.
And to that point, the families who used hotspots during the pandemic, were they required to turn those in?
They were,
Okay.
yes.
How many, so here's a continuation of that thread is, I think that Wi-Fi and internet connectivity is sort of a non-negotiable, even for regular school days and regular school, because so much of our students' learning takes place on Google Classroom, and I don't really understand how a student who does not have good connectivity from home could effectively do their homework and turn it in and engage with our students and collaborate with how I see my students doing online when they're doing their homework, and working together on a document that's online. So I'm just wondering if we could look at those numbers and maybe we should just make sure that all of our kids have access to the internet. And what about, you know, this whole high-speed thing that Decatur just did that we collaborated with, and we chipped in millions of dollars on that, and how are we leveraging that, and just what would it take to make sure that all of our kids are connected? Because I feel like that would help bring equity home for all of our students, and I think that would be huge. So I would be very interested to know what that would take in terms of technology and budget.
Yeah.
I can tell you one thing, if you haven't toured the new community center up here, at CJ, it's wonderful, and students, they have a computer lab in there that's open for students to come in and use it. We also have one over here, on the Trinity. And then what I've done too is, if there's a need, we had some summer school kids that needed a place to go for summer school, even though they were doing online. I said, hey, come on over to this school, sit in the media center. We've got people in there so they can supervise the students. And Doug has been great with DHA on supporting that as well at the community center. And then we also have installed improved wireless so that the student could sit outside of, say, or outside of the high school and get onto the network. So even if they may not be able to get in the building, if they go sit on the bench or, you know, at one of the parks, they should be able to get Wi-Fi there.
I'm just thinking, you know, a lot of the time that a student is doing their homework, it's pretty late.
Yeah.
You know, it's 10 o'clock, I wouldn't really want my kid out. I don't know if the community center is open that late. Maybe if this is a question of money, we could partner potentially with DEF or find some other partnerships, or maybe we have it within our budget, and maybe it's not even that many students. I mean, maybe I don't know what the dollars are, but I think it would be really worth looking into.
We're already providing laptops, aren't we?
Yes.
So we're just talking about extending it so that a laptop is a hotspot.
It was interesting that we got that from calendar, but I guess it threaded into the at-home learning question.
Okay.
So.
All right, well, I will gather that information about those 225-day employees, about switching that day, and bring this back for action at our July board meeting. This part is for information. Just wanted to update the board on a couple considerations we're looking at making for mitigation policies, or procedures, I should say, for next year. So there's an attachment in there, and it's got the Stronger Together hashtag on the top, and that is our theme for next year, is that we believe through community partnerships and through working together as a school district, if we are together, we are stronger. So really driving that theme home with our parents, with our staff, with all of our community members, that together we can be stronger. So always the safety of our staff and students is a top priority, to make sure that we have the highest quality of education for our students. But we do know we do have to have mitigation strategies continuing through the fall for COVID-19 to make sure that we have a healthy learning environment. So we are implementing a multi-layered approach like we've done in the past. We are looking at making some changes. We've done some research and we've looked at what are the recommendations from the CDC, talked with the DeKalb Department for Health, as well as consulting with the team of health and medical and healthcare professionals who live and work in our community and know our community. So we really are trying to closely align our mitigation plan as much as possible to the recommendations from the CDC. And we know that those keep changing over time, but two of the big ones that we're looking at, first of all, is masking. So we know that Governor Kemp updated an executive order, and initially people read that and thought, oh, you can no longer mandate masks at school, and that's actually not the case. You can mandate masks, and his executive order basically said you cannot say masks are required because of a health emergency. So that being said, if we want to mandate masks, we could do that. I do not recommend going against what the CDC is recommending for fully vaccinated people, requiring them 100% to wear masks. So the current practice that we have in CSD is that we have mandatory masks for all people in all buildings. So we're looking at making the updated considerations for the fall. So basically at the high school level, telling students that if they are staff and students, if they are fully vaccinated, they do not have to wear a mask. If they can, if they want to, but that's an option that they have. We would recommend continuing mandated masks in buildings where students have not had the opportunity to be fully vaccinated. And this includes asking our teachers to be good models for our students so that they see adults also wearing masks properly. And I also include the middle school in this because we know that even the 8th graders it's hard when you mix a bunch of students together, who's 8th grade, who's 7th grade, who's 6th grade. So we are gonna look at mandating masks for the middle school down. So mandating masks for all people that have not had the opportunity to get vaccinated, and then also updating our outdoor mask policy. So when students are outside, saying that, look, if you're, we're strongly recommending masks outside if you can't keep social distance, but it's not, we're gonna switch that from being required. Department of Health updated their recommendations as well, and they are mirroring the CDC with not requiring masks for fully vaccinated individuals. The other change that we are looking at making is under the area of contact tracing. So isolation, there's two things in contact tracing. There's isolation. If you're a COVID positive person, you have to isolate until you are symptom-free for so many days. We're not changing that piece, but we are looking at making a change in our quarantine policy. So quarantine is, I'm sitting here, Lewis is sitting next to me, I test COVID positive because he and I were deemed in close contact. Now I have to go home for however many days. Our normal quarantine policy is that Lewis would also have to go home for that many days as well, even if he was testing negative. And then we have our policy for how people were monitoring their symptoms, and if they did develop symptoms, they would share those with us, and we would continue the contact tracing protocols. The students were missing somewhere between that were never positive, that were typically in the classroom, were missing up to 7 to 14 days of school, just depending on when the contact tracing was identified. So we're looking at making a change and doing something called a modified quarantine. And just to give you a little information here is for every 12 asymptomatic people, we would quarantine 12 people on average for every one person that was COVID positive last year. So when we total up the time of how much instruction was lost for quarantine of students, you can see the total there is about 25,000 days of in-person instruction. So it was a significant loss for people that never tested positive, but were deemed in close contact. So what we're recommending is that we give our parents an option, and we say, if you want to commit to your child wearing a mask, because we know masking is one of the top ways to prevent the spread of COVID, that if you say, yes, I'm committing to my child wearing a mask, means I will have the modified quarantine option available. And what that basically means is, I'm here, test COVID positive, Lewis sits at the desk next to me, he is in close contact, but because of all of the rigorous mitigation strategies in place, and because he was wearing a mask every day, and his parent committed to it, his parents will have the option, instead of having him be home, that he would be able to stay in school and not miss instruction because he was deemed in close contact at a school setting. So there's a lot to this. We've been in discussions about this for probably 4 months now with a team of these health experts, and have come to what we think is a good solution. And when we look at the data, we know that there is very little in-school transmission of COVID-19 because of all the rigorous mitigation strategies. So I feel very comfortable recommending that we proceed with a modified quarantine for next year because of that low in-school transmission rate. All students that we had to quarantine, you can see the data there that we didn't have any in-school transmission. Really strong reason to say why, if we are prioritizing student learning, particularly after a year where students lost so much time in the classroom, feel strongly that we need to prioritize that. And because we've seen it safe with our mitigation strategies in place, I think that it's something that we could go forward with. We will test individuals. So if Lewis is determined to be in close contact, he will have the option to be tested with one of our rapid tests. If he does test COVID positive, he would also be put in isolation. but if he tests negative, he would not be allowed to continue in school. We have worked with the DeKalb County Board of Health, and they are in support of this too. We're going through a couple more hoops with DeKalb Board of Health to make sure, because let's say someone from DeKalb County calls and has to be, goes through their quarantine process, may be different than ours, so we're getting, an agreement with DeKalb Board of Health to make sure that they're on board with this as well, since we operate within their system. And then also we would continue to track, so if at any time, let's say Lewis does start showing symptoms, if we can't contact trace that with another exposure, we're working on the details of what that might mean for this process.
I'm a little confused. If you test negative, so I'm being tested because I was in close contact with someone else.
Yep.
But then I test negative, I would think I can come out of quarantine.
Right, he wouldn't be in quarantine at all. Yes, yes.
And it's,
So, close contact. If Lewis, in this scenario, was vaccinated,
Not have
then
to,
he's not
correct,
considered a close contact.
right.
So this
Yes.
really only applies to the unvaccinated.
Middle school and below is what we're talking about.
Some seventh graders, depending on where their birthday falls, are not old enough to be vaccinated. So kind of some seventh graders and then below.
I'm wondering how can we require masks at the high school for unvaccinated if vaccinations are not mandatory?
We have to really figure out how to manage that process. So here's what we're thinking for when registration comes to our students. When they open up the portal and you've got to go in and check off all the forms, parents will have to say this student has been vaccinated, yes, no, prefer not to answer. If you are a no or prefer not to answer, we're going to say that you should be wearing a mask. Now, policing that is a whole issue, right? We have to kind of use trust. We're not going to be the mask police if we're going to list masks as kind of an optional requirement at the high school.
I'm concerned about, the lower grades, the 12-year-olds and under, who the vaccine is not available and masks not being mandatory in those.
We are, yeah, no, it is.
They are
Yes.
mandatory.
Mhm.
Okay.
Yes, we will
All
say
right.
mandatory masks for 8th grade below.
Okay,
Yes.
got it.
So of all this, so I think we clearly need to refine the quarantine, so I think it's good that y'all are thinking. Proposal seems fine. The parental commitment seems a little bit problematic to me. But we're tied, number one, because you're not going to be able to enforce it. It's not really clear what we're saying. But it also doesn't seem connected to the actual quarantine. So if I'm in close contact with you, and what? I guess I'm the one, you got it and I don't. My parents committed to use that I would wear a mask, but I'm not wearing a mask. So I'm eligible for modified quarantine. That doesn't make any sense. And likewise, the parents didn't make that commitment, but during the period of contact, I was wearing a mask. So maybe I should be eligible for the modified quarantine. It seems like we're extracting a promise, give them this benefit in a way that's a little bit disconnected from the actual risks associated with the exposure. In a way that seems to me potentially problematic. Particularly, I mean, a lot of this is going to draw some opposition and mention. I thought that the governor had expressed some interest in an executive order that would prohibit businesses from discriminating based on who has been vaccinated and who hasn't. That's should, if it makes sense to do so, but these are kind of hot buttons.
Yeah.
And the commitment is going to affect all complaints and might, I don't know that the logic of it is that easy to defend.
So the thought process behind the commitment is for parents to understand the value of wearing a mask, and that if you are saying as a parent, yes, I'm going to send my child to school, I'm gonna tell them it's the expectation that they wear a mask all day, all day at school to help prevent the spread of COVID or being exposed to COVID. That's kind of the thought process behind it, to almost use that as the leverage to help encourage parents to encourage their kids to wear the mask. And I'll say, K-5, I feel pretty confident, very confident, I'll say, that our teachers know if the kids are masking appropriately or not. They're very cognizant of that, and of all the schools I visited, and every school I've been in, the mask compliance is really high. Our kids do a really good job of wearing masks.
So is it gonna be then that the parent made the commitment and the teacher has observed the mask has been worn properly? That's stated here?
It's not in there, no.
That same section on page 9, I think it goes back to my earlier question, but bullet point number 1, it says, parents who commit to their child wearing a mask, whether vaccinated or unvaccinated, are extended the opportunity for modified quarantine. If they're vaccinated, they shouldn't be in quarantine anyway, so that.
They don't have to, but they can say, no, I want my child quarantined. So a parent could say, yes, my child was in close contact, even though Lewis is vaccinated, I'm okay with him being quarantined regardless.
Because there's still a possibility you can contract COVID even vaccinated.
So this is
I can-
following on the same thing. If I'm vaccinated, I'm only eligible for the modified quarantine.
No, you don't have to quarantine at all.
I just think it's
Vaccinated.
unclear.
Gotcha.
Mixing it into that statement, like, because close contact is defined as an unvaccinated person.
Yes.
And then we're saying that if you're in close contact, then you are quarantined, either modified or unmodified. So the overarching definition of close contact is not being met. And so we can call that something else, like that's not modified quarantine, or that could be self-quarantine. But I just think that that is making it muddying the modified quarantine option and making it unclear that it only applies to unvaccinated students.
Because I'm not sure I understand it. When I read this, it says very clearly that I am not eligible for modified quarantine unless I wear a mask, even if I'm vaccinated.
That's why I'm gonna take out that vaccinated, whether vaccinated
So
or.
that'll change.
Yes.
Fine.
Yeah, I'm looking at this,
Yes, that's a.
Oh, I'm looking at the wrong.
and because there's, all the definitions are on here of modified quarantine, routine quarantine, but the definition of close contact is on there, and that's what I wanted to clarify first, because that's kind of like that criteria has to be met to then even determine whether you go modified or routine quarantine.
When you're doing the modification, you'll add that the full wearing of the mask is going to be part of it. That'll go into the text.
I don't understand how the quarantine, date changes between 7 to 14 days, depending on the date of exposure. I don't understand that part.
So it's a range, so they don't, and if you test, and after certain days of exposure, if you test, then if you test negative, then you can come back earlier. So that's where that range comes in. If you don't get tested, the set 14 days is total days, not school days. So school days, they could miss probably no more than 6, 7, maybe 7 would probably be the total days. But it's 14 calendar days, 2 full weeks of quarantine.
So because I don't see, I'm looking at on page 9, at the top, the third bullet point before under consideration. The CSC, okay. Quarantine could be assigned for a range of 7 to 14 days, depending on date of exposure, but you think really the days that they're tested?
So if I get exposed on Tuesday, then that is day 0. And it's how you count from the day of exposure. So if I get exposed, let's say on a Wednesday, then I go quarantine starting the next day, but I don't find out till the next day. So day 0 is the first day that I actually was exposed. So day 1, and then you count those days. So just depending, right now we're only doing testing for staff, so there is an option also to expand testing for return and cutting down the number of quarantine days based on test results. But it is just a range based on the date you were exposed, the total amount, like that's 14 is the longest day.
Right, but what's the minimum?
5.
Just a-
But that's like getting your test back.
The whole week and then the weekend.
Are you saying that the range depends on how many Saturdays and Sundays are included or something?
Well, that range, that 14 days can be assigned quarantine. 14 days is total days. Not this, 7 to 14 is not school days missed. 14 days. And I put that in there because people should be in quarantine even though they're not in school.
Right.
So we want them to understand, just because you're not in school doesn't mean Saturday and Sunday you should be out running around playing football with your friends. You should still be in quarantine. That's why we use calendar days instead of school days.
So does it says somewhere that you have to quarantine for a minimum of this number of days and then test on this day number?
Yes.
Okay.
Department of Health updated that. So after day 5, you can get tested. It just depends on then how long does it take for your test results to come back.
And then my last question is, a community member forwarded this to me, but at the bottom, it says IRB, Emory IRB version.
What version?
It says, it's not on here, the bottom, it says Emory IRB version.
Gotcha.
And so, is this a study?
No, this is not a study. And that is where we started, is that we were looking at it to be a study, but then we decided we don't want to do it as a study because we feel the evidence is so strong that it makes sense for our district with COVID numbers so low, with the transmission for in school being so low, that I feel confident that it doesn't need to be a study, that we could adopt it as practice.
Okay. So because I was also informed that an IRB application has been submitted, but that is not going to be used for this.
So there's and I'm a little confused on this too. We have to submit, quote, an IRB to DeKalb Health for them to follow through their process. So that's kind of the hoop we have to jump through with DeKalb Health to make sure we've met all their requirements to modify the quarantine, because we are doing it different than what they would recommend to a school in DeKalb County.
What would they recommend to a school in DeKalb County?
They would recommend a written policy that is what they have with the 7 to 14 days, just depending on date of exposure and testing and when you get your test results. They are in support of this. We've been open and had conversations with DeKalb Board of Health.
You know, with the Delta variant, you know, they're saying that it will be the dominant variant soon, and it's more transmissible, so it's, you know, easier to transmit. I'm concerned about, you know, because it's going to be hard to police students, especially the upper grades when they're changing classes.
Right.
Teachers won't know whose parent, who has the vaccine and who doesn't have the vaccine, who's supposed to be wearing the mask and who isn't. And I'm concerned about unvaccinated students and the possible transmission of this more transmissible virus that's going to be the dominant.
We talked about that in our committee, and I think it's like trying to plan for the unknown. We can't tell the future. I think we have is numbers and data that we've seen and practices that have worked. And we can't tell if the Delta variant is going to be, they can model, they can say this may happen, but I don't think we have solid evidence to say that it will. So I think going forward, we need to use the evidence that we have to make a decision for how we can start school and keep our kids in the classrooms as much as possible.
Right, but I guess the evidence does show that masks are the most effective thing.
And that's why we mandate masks for the 8th grade and lower.
But we will have some students in the upper grades who are not going to be vaccinated. And likely, some of them will not be wearing their masks. And so that's my concern. We know that the research shows that masks are the most effective. I feel like we should mandate masks in the upper grades too, maybe at least until January, to see how this variant virus plays out.
I was also wondering about close contact, and it says that we're following basically the CDC definition of close contact, but I know that in certain situations, we've very liberally applied that definition. For example, if a student in a classroom sitting in the corner had tested positive for COVID, we quarantined the entire class. We're not doing that.
Nope. No, we're sticking to that definition.
You said that, can you explain, when I'm reading through this document, the modifying quarantine document, and it's talking about 10-day quarantine and all the text, but then there's this table about 14 days, 10 days, and 7 days. Are all students going to be given the option to do a 7-day quarantine if they get a negative test after day 5?
That's one that we would have, that we could consider as well.
Okay. So I didn't understand why that table was there, because in all the text, it's still talking about 10 days, 10 days, 10 days. So what does that table
It's
mean?
communicating the percentage of likelihood to test positive after a number of days in quarantine.
I was thinking, since we have now these tests in the schools, I think before it was very difficult to go and get a test. It was arduous. Parents would have to drive. You might have to make an appointment. An appointment might not be available. And our nurses were also, I think, overworked with contact tracing and doing a lot of extra work. But now that we are in the place where we have many of our students vaccinated and we have like very good mitigation strategies in place, I'm wondering if we can leverage the testing that we have available in our schools to be able to now support increased days of in-person learning by using the 7-day quarantine with the test that we can now administer in the school. Like, it just seems like we might be able to facilitate that and have more in-person learning days.
Yes, and that is an option, but I prefer the no missing days instead of the missing at 5 days.
Absolutely, but I'm talking
But
about for the unvaccinated
Right.
students who are in close contact,
Mhm.
who have to quarantine.
Oh, I see. Right, if the parent chooses to quarantine, let them come back after.
Right.
Yes, we
Yes.
would, yes,
If they
definitely.
want
I see what you're saying.
And also even for, because I see that there's a distinction, because it's only for in-person learning, but not for activities. But it seems as though if we are able to facilitate this for the unvaccinated students who choose to quarantine, whose parents choose to quarantine, or even just so that they can get back to playing football or get back to being in chorus or whatever it is that's, an extracurricular activity, I guess, theater or whatever. I feel like we can leverage that now that we have this test available so that those kids don't have to miss it. And I'm just wondering about that distinction between in-person learning and extracurricular activities, if maybe it should just be like, they can either be back in school or not, they're quarantined or not. And why the
I can
distinction?
take it back to the team for some clarification on that, but the thinking is that if students are practicing football or out on the field, they may not be, because they don't always wear masks out there. I mean, I've seen them practice, the mask compliance isn't as strong as it is in our classrooms.
Mhm.
And we haven't done, that I know of, any studies that were brought to me, studies about COVID transmission during extracurricular activities. That was more outside of the scope of what we were trying to.
But we didn't have any transmission in the schools, including extracurricular activities last year. And I'm just thinking that if those students did do the modified quarantine with the mask and agreed to wear the masks, if they wanted to come back and, participate in in-person learning and extracurricular activities following the modified quarantine guidelines, if that would be sufficient, and why not?
How many false, so the testing, we apparently are talking about the PCR test.
Rapid test.
We're talking about rapid tests.
Yes.
So they have to quarantine so now I'm confused, because the rapid tests are rapid, but they still have to quarantine for 7 days? I'm very confused. I'm trying to figure out where to follow.
The test results are rapid, but you take 5 days before
You have to
can
wait 5
show.
days after exposure to take a rapid test. But we would still be giving, the point of giving a rapid test to the people that are in close contact is you really just are saying, is this person an asymptomatic carrier and is sitting in the classroom anyways, you can rule that out.
We had no transmission in extracurricular.
That I don't know. That I'm not sure. In
Right.
classrooms, I can tell you.
In your scenario, you have COVID, you're sitting next to Lewis.
They'll pick on that.
Okay, I'm the one with COVID.
Right, that's true. And you were wearing your mask. You said they have an option for the child to take the test.
Yes, we will not require rapid testing.
So if Lewis's parents do not want or do not say it's okay for him to get the rapid test, will he then be automatically quarantined?
He's not masked, he has to.
I thought if he wasn't vaccinated.
If he's vaccinated, he's in the clear regardless of whether he's wearing a mask or not. But if he is an unvaccinated person without wearing a mask, he has no option for the modified quarantine, he has to quarantine.
And that's if the teachers are able to effectively, depending on if they're switching classes and stuff, be able to, like K through 5, like you said, would be pretty easy, but middle school, we might have some kids that we wouldn't be able to say for certain if they've been wearing their mask.
Passing period's only 5 minutes, so, or, you know, if they take their mask off for a break while they're in the hallway, we don't want them to do that, but it's only a 5-minute passing period, so they'd be back in a class, just monitoring their mask compliance. The lunch is social distancing, so even if they do have to take their mask off, well, they do have to take their mask off and they're eating inside, we are putting social distance parameters on there, so there should be no close contact. For classrooms, we can't guarantee that 6 feet of social distance because of the numbers of students.
That lunch is gonna be.
Will you continue, like, I know at Renfro, I don't know about the high school, but y'all did some weird things with the bells so
Yes.
that people didn't pass as
Correct.
much.
Good questions?
Yeah, I know that.
Okay, go for it.
You said that we're just gonna do what the CDC recommends. Love hearing that. Editorializing, they've struggled to come up with recommendations. Where are we getting the change of the mask variance? Because the last I read was the May 15th, that says, until the vaccine is available for all, universal and correct mask use is recommended by the CDCs for adult and children in schools regardless of the school's vaccination status. So I love pointing to like, well, here's where the CDC says that, so I just didn't know.
So the difference is Governor Kemp's executive order about masking and the interpretation that was taken from the school districts, saying that a lot of school districts interpreted that as can't wear masks, can no longer mandate masks in the schools, but that wasn't the case. So we're still going to comply with what the CDC is.
But we're not. You're misunderstanding. I'm asking the opposite question. The
Oh.
CDC says we need universal masking until vaccination is broadly available.
Oh, for public schools?
Seems like we're not.
Oh, yeah, no. We are very, sorry, yes, we are not requiring masks at the high school level.
Where?
Yeah.
You said it's because the CDC said that they were okay with that. I have not been able to find that. So I was just, where are we pulling that from?
Sorry, I was looking at their general masking policy.
So I'm confused now. So the CDC has a general policy. Can we get clarity on that?
That's why we're sitting here with no masks. We're all fully vaccinated.
Right. It seems like that would be apply in school settings or elsewhere.
So they said that universal, and I guess this is where James is pulling up their school guidance, didn't yet follow through with meeting that threshold of allowing masks in a building for unvaccinated people.
Because they released it on May 15th. You know, they came out and they said, hey, with vaccines, we're lowering for the general guidance, the requirement of masks at level. And we had a discussion, was like, should we do it for schools?
Mhm.
And we were all like, and then the CDC immediately came out and said, whoa, for schools, let's keep it through the end of the school year. They have not updated that. They came out with a May 15th thing that said, keep it universal,
Yep.
regardless of vaccine status.
Mhm.
We will update this moving forward. It seems like we're waiting on the update, or has there been an update that?
So that is a good one. So that one is where I pulled from the from the Department of Health. They sent out their update where they recommend masking for unvaccinated people in school.
So so that I'm clear, I think the CDC issued a recommendation for the completion of the 2021 school year.
This is still their 21-22 recommendation. It's to
But it's
keep.
still, so I'm not, so, okay, so they're still saying that for now you should have masks.
They're saying that you need masks, you know, I mean, one interpretation could be, you know, we have very separate buildings than most other places, and so I guess there'd be an argument, but it's unequivocally, I wrote it down, universal and correct mask use is recommended by the CDC for adults and children in schools regardless of the individual's vaccination status. And then it goes into like modeling and the ability to police it and making requirements. There's a section on equity. I mean, it's a pretty thorough recommendation. And I hadn't seen an update. I didn't know I should be looking for DeKalb, but like we should follow the CDC there a little bit. I mean,
The other thing to consider is no other metro districts are requiring masks. We can require them, the DPH does require masks on buses, and that's it. So, as I checked with other superintendents, if we are going to make a policy within CSD to be outside of the realm of every other metro area school district, we have to have a really good reason for that. I can stand behind mandatory masks K-8. Mandating masks in high school takes it to a level that's way outside of the norm. And we just say, if you're unvaccinated, you should be wearing a mask in high school.
And the DeKalb Department of Health supports what you're
Recommending that.
I think that there will be community members that follow the CDC guidelines. And it felt like I had heard that that's what we were doing.
I think it will be interesting to know if, you know, when we are able to find out what our vaccination rate is, because I have a feeling it's very high. It'll be very interesting to know. Because statewide, it's not for younger people, but I think that could influence how we are able to respond to some of these requirements and mitigation strategies.
You know the numbers as well for our teachers?
It's kind of, for me, it's an anecdotal one, as I have conversations and people have just shared that they've been vaccinated. I feel we're very high. I feel we're in the 90s, 90% of staff being vaccinated. Like, we're really high, but we're going to do a survey.
I mean, for my part, I would lean toward the CDC has a specific recommendation. It's hard to see not following it. I don't like being out of step. I feel like we've been so conservative and not good. I noticed in the article about masks, they call out Decatur as one, very few schools in the state that are going to, don't like being an outlier. At the same time, if I don't, like last year, we didn't have CDC guidance. We said follow the guidance, like, you know, they don't have any for us, right? But now if they have specific guidance, feel differently about it and would default to following it. That's just my opinion. I don't feel as strongly about the mask guidance. How strongly we need to get back to school. Different kind of cost-benefit analysis about whether you're requiring masks because people are participating in activities who are just wearing a mask. I don't feel like that is as great an imposition. If there's health guidance that says, put it this way, my default would be whatever CDC says.
I agree with other board members. I think we can stand firmly in following CDC guidelines. As Louis said, when we didn't have them, then we just had to go for what we knew. But we do have guidelines now, and I think they're also watching how the variant young kids, and that's might be why they haven't quite given us an update yet. We need to just see what that's doing and how strong it's going to become. And so, you know, I would rather us be in a space where everybody's wearing a mask, and then as we start to hear from the CDC, we can bring it down versus our kids get used to not wearing it, and then the CDC says this variant is really strong, everybody needs to go back to wearing masks, and that's going to be a harder kind of swing to get everybody back into the swing of wearing masks at school. And then also just wondering how we would police, if we even can, if we're coming to school, how we will even be able to, you know, because that's almost like they'll be telling on themselves. If we have, you know, 10 kids walking together and 2 of them have masks on, then there's this stigma that could follow them that, yeah, those 2 wearing masks because they decided not to get the shot. So I'm just wondering if we can look into that a little more, you know, and it may be 2 weeks before school starts, we'll get something from the CDC, and it'll be easy enough to bring it down versus having to go the other way. I don't know, maybe we can talk a little.
Are we sure APS and DeKalb County are still doing mask mandates?
APS, I haven't heard back yet.
I just saw in the article that I read that might have been dated.
No. They're recommending them, but they're not mandating.
The same for DeKalb County? They're just recommending?
Cheryl is, yes.
Oh, Cheryl.
When did that, there was an AJC article the day after the governor's executive order. That might have been May.
Yeah.
Yes, you haven't heard back.
I haven't heard back from them. All the other metros, Henry, Clayton.
I'm okay with being an outlier. You know, we're outliers in so many of those things positively, as it relates to those districts, some of those districts.
And it's a hard space to sit sometimes, because I think when we have heard that when other districts are doing something, when we do get that, well, the other districts are doing it, and then we get the flip from other sides of, well, we're not like other districts, and that's why we live here, and that's why we pay the taxes that we pay, because we do it differently or our way, or, so, I mean, we always have that argument one side or the other. That's why I think sticking with the CDC, as James pointed out, really then just puts us in, we're not following Atlanta or DeKalb or anyone, we're following CDC, and we can stand confidently by that, and we're gonna have the emails either way. So I would rather be able to respond to the emails of, why does my kid have to wear a mask, they're vaccinated, and because that's what CDC says we need to do while we're in school. As soon as that changes, then we will follow suit, somewhere along those lines, I think.
I think if we're, you know, as we are doing our mitigation so well, and our numbers have shown that we have not had transmission rates, that we need to also not be afraid to resume quote-unquote normal activities and normal learning and normal extracurriculars, and really maximize the in-person learning and the in-person participation in extracurriculars, because our kids have missed so much the past year and a half that I feel we need to, in that situation, err on the side of to normal and monitor it closely. But we have not seen any reason to not be back in person in extracurriculars and in in-person learning, and having lost so many days due to, you know, the very conservative approach that we took last year, I think will justify, because of our strong mitigation, being able to care and lean toward being back. And I think we can do that. I think that is where we are capable and diligent, and we've had really good adherence to our mitigation practices, and it shows. And now we have numbers to back that up. And so I think we should err on making our school experience quote unquote normal for our students.
Did you have any other questions?
I did, I mean, I think the column at 43 is good. But the quarantine thing, but to do this, I read that last bullet, we will, the Board of Health will give their check on this.
Our final thing is us submitting as that IRB, which kind of puts it all in official protocol,
Okay.
and then we'll be good to go.
Listen, that's for that. But, I mean,
The team is helping me with this, so
but after we submit that,
nurses will collect the data as they do the testing.
okay, and then they're gonna submit that data to
The CAP health.
What's the guidance that you said you were following from the DeKalb Board of Health regarding masks?
That's they only recommend masks now. The CAP health no longer listed as a required mitigation strategy for schools.
For any ages.
So, I mean, what do you do there? You know, you have two agencies that are both.
And that's why I kind of came to the middle ground about high school, because all those kids have had the opportunity to get vaccinated. Working with our lead nurse to try to do another mobile vaccine event to get more kids vaccinated that haven't been vaccinated. And then just, you know, saying, okay, high school, 9th grade and up, you've all had the chance to get vaccinated. We know everyone in the building has had the opportunity to get vaccinated. Let's relax that masking policy at the high school, but keep it mandated 8th grade and lower. And that's where that was my middle ground for that.
And is there, I mean, if we went that route, we say that we will monitor, and if for any reason we see a change in numbers or, you know, a reason to do things differently, that I feel like all along we've had to be nimble because this is an evolving situation, and like Jana brought up, maybe there will be a variant that will pop up and we may need to deal with that. But all along we've had to be nimble, and I feel like that we will benefit from that as opposed to trying to now set a policy that we believe will not change until January. I don't think that's realistic, and I'm willing to say, let's make the best decision we can with the information we have right now, and we have the ability to monitor the situation very closely and make some modifications and changes if we need to, but do what's in the best interest of our students every step of the way.
but our biggest mitigation strategy has been math. That's been our best mitigation strategy. That's what we know for sure. Now we are taking it away.
Well, we aren't, the I guess.
The CDC is
Well,
not.
I think the best mitigation strategy is the vaccination. So
Well, I
when
mean,
we have a high number of students vaccinated and a high number of staff being vaccinated, and the numbers are so low in our community, I think to me it's a little over the top to do required masks at high school.
one thing I know that we've heard about herd immunity a lot nationally, like if I know that we had reached that here in CSD, you know, with the large number, right now, we don't know how many folks have been vaccinated, how many students. We know that, you know, the high school age group and up to 24, they're not getting vaccinated.
Our high schoolers, they're getting vaccinated, yes.
Okay, well, I
We
know
had
nationally, that's
1,200
been
students at our vaccination event.
the
There's a
national
lot of
news
kids.
story has been that age group has not been, and so I would feel more comfortable if I know what the higher number, like you're saying, you know, we have so many. If we were at that level of herd immunity, then okay, but we don't have anything. All we know is that masks have been our best with mitigation strategy, and it's what the CDC still recommends. I'm hesitant to not follow that guidance, knowing what we know.
Yeah.
And the Delta variant is here.
Variant is here.
Right, it's not coming, it's here.
I think one state in the United States that doesn't have, this is a new variant.
how can we get better data on that? We have some, we have pediatrics may be able to tell us how many Renfro and high school students they did, but it wouldn't be everyone, because people could have gotten the vaccine other places. So I wondering how soon we can.
We're trying to see if there's a way. And even if it's we don't know, hey, these is the list of kids, but we can get a number of students assigned. So we're trying to figure that out, just so we have better information.
Understanding, because I haven't checked it lately, and probably should go in and look again soon. And maybe we can get an update on some numbers by our July meeting, just to understand what is our community threat. Where are we?
We're not low, we're moderate right now. So we're not in high, we're in the yellow category.
So like 30 to 60 or something.
Is 10 to 20, I think. We're getting every day, I watch the numbers every single day, and we get lower and lower and lower. And then the two, people that work in the ER on our committee, their positivity rate of, they test everyone is less than 2%.
Those numbers are very different than what we've seen.
Correct.
Yeah, so that can inform our decision too. Like, just to state the extreme, but if we were at 0%, then we wouldn't wear masks. But we need to kind of understand a lot of different, I think we're taking data from different places, and the more we know, I think will help us feel comfortable.
I will look at the mitigation strategies and see if there's any updates we need to make. We announce our final mitigation plans, and just so you know, there is a timeline on the bottom of that. Doug Faust has been gracious enough to let us host the town hall in the community center, so we can do make sure that any parents that want to attend in person that live in DHA will be given priority to sign up for in person. We'll also stream the event via Zoom so that people can watch the event and ask questions to our panel of healthcare and medical experts. So we're going to be just making sure we get the word out there loud and clear about what the procedures are, what to follow up with, and how to do that. I need to speak louder, Shana? Thank you. All right.
Thanks for your committee's work on this. I know it's a lot.
Yeah, they've been doing a lot of work. Okay, so tuition, this was the next topic for the agenda. And I'll put okay, so I thought this discussion had been wrapped up a while ago, but not, so we'll go through this tonight. So objectives is to give you, as the board, overall information about our enrollment projections, our current enrollment, the gap, and then talk about some benefits and some drawbacks, potential drawbacks to opening up for tuition. So current tuition practices is we still have a couple grandfathered students in the tuition. So way back when, I think enrollment, one time Heidi shared with me, in 5th grade, it was 11 students. So they opened up enrollment, brought kids into the school system. Some of those students left, some moved into the district, some are still here. So there's a small handful of students that are still in the system. Also, any students that are in the active process of moving into the district, so they've got a contract on their house, but then they can't move in until, let's say, October. If they have a contract and they've got the papers, we let them pay tuition until they actually move into their house. And then any seniors that move out during the school year. So we want them to finish as a Decatur High School student. So if something happens and they have to leave and move to DeKalb County, we go ahead and let them pay tuition to finish out. So those are our current options for tuition. And I wanted to share our numbers just to give you a very accurate picture. I pulled this data last Friday. The numbers in the red blocks are where we are below enrollment. The numbers in green are where we are above our projected enrollment. Just so you can see those numbers, we are very low in kindergarten and 1st grade. That is pretty significant, low. But the benefit of being low in kindergarten and 1st grade and 2nd grade is we can social distance really well in the classroom. Fave and Tally, they're pretty close. I'm not worried about those at all. I think we'll get where we need to be. Then also just the data for Renfro in the high school. Renfro is a little lower, but we typically make up those numbers in the summer, particularly after 4th of July. More families are moving and enrolling, and the high school looks fine as well. So the next graph is kind of a line graph to show you a 5-year history of what our withdrawal rate is. So these are the graph shows you, these are the kids that left our district at some point in a school year. The orange band are students that have moved outside of the U.S. That has remained pretty consistent, even though it's been up and down, the number has remained consistent. Transferred out of state, also that one has kind of decreased over time, even though the trend is up for this current school year. The numbers of that haven't changed overall, as in regards to proportionality to the total number. Transferred to another Georgia school, those numbers also significantly increased. And that's kind of been trend over time, either more or less, of the makeup of the students that have moved. Private school and homeschool. Private school is the red area, homeschool is the blue area, and we see significant rises because of, I'm assuming because of COVID, that these families withdrew from our school system. So and you see just over a 5-year period, we did have a significant number of families leave our school district, higher than any other year in the past 5 years. You see the percent of students leaving either to go to homeschool or private school also significantly increased. I also wanted to give you a picture of how our 4-year average changed with the additional huge loss of students from last year. So the blue line is the previous 4-year average, not taking into consideration last school year. And then when you add in, create a new 4-year average with the 2020-21 data, you see a huge difference. So you see our overall total significantly went up. And then the number of students for that private and homeschool, those averages went way up as well. So are these kids coming back? I sent an email to every family that withdrew last year and asked them, are you coming back? Or are you not coming back? It went out to, I don't know how many families it went out to, but I sent it to 275 independent emails. When I pulled the data, I had just under 100 responses. So you can see from the data, 98 responses, about 32% of the families surveyed are sending their kids back. About 26% have more than one child, and they have, let's say, 3 kids. They're sending 2 back, they're keeping 1 in private, or they're sending 1 back and they're keeping 2 in private.
Did this go to everybody, including people who moved out of state?
No, this only went to private and homeschool. So if they sent their kid to private or homeschool, if they moved out of district, I didn't ask them. But people that still reside in here. And then the biggest percent is that 36.7% that adamantly said no. So they were like, not coming back. And then there were some not sure's yet, that people that had questions. So I gave opportunity for people to tell me why. So when I said, yes, you're coming back, what was the deciding factor? Overall, it was providing in-person learning for students. Families needed that in-person learning option. Some people left last year and have shared a pretty strong dissatisfaction with the school system. Been reaching out to those families, talking with them a little more, giving them times to schedule to meet with me and share what happened, what was it, and I'll share that data with the board as well. And the maybes left because they needed in person. Some are dissatisfied and are waiting another year to see how we operate, and some need in person. But what they share is they were in kindergarten last year, or first grade last year, they left, went to private or homeschool, or whatever option. This next year, they're in 2nd grade, they want to come back at the change of a school. So because there's a grade band change, that's when they'll come back the following year. So I think overall we'll see our students return to us, but it may not be this coming school year, but I think 2 years from now, we will see, I would say, most of our students returning to us. So cost of first of all, the cost of what it takes in Decatur to educate a student. So our per pupil expenditures last year were $15,030. Previous to that, the 2-year average of 2018-19 was $14,000, about $500. So significant increase in per pupil cost to educate students. The max tuition that we can charge is $5,670. That number is set by the state. We earn per student from the government, $2,620 per student. So if we charge tuition per student, the income we get per student is $8,290. So a gap of about $6,000 that we aren't getting if we take a student in on tuition.
Doesn't seem right to me. And maybe it is, but it doesn't seem right. It's not similar remotely to the numbers that we've been shared in the past. So my understanding of the formula, which isn't fixed at that number, it's set based on the local cost to educate your child.
The tuition cost?
Yeah.
Oh, okay.
So I thought that the formula was the local cost, take out the federal money, have to take out the state money, and what is the local cost average per child? And the only thing that the state reduced that by was the local fair share, which is 5% of the taxpayer. So it had been, in fact, it's been one of our legislative agenda items, try to get somebody to let us charge the actual cost. It wasn't because we were losing 50% of the cost that we're spending. Instead, it was because we were losing, we just wanted to get back to 5% fair share. So this delta that is shown here doesn't square with my understanding. So maybe I'm wrong, but I'm not.
Heidi, if you're on and you want to jump in, this is Heidi and Courtney pulled these numbers together and reviewed them with me.
So
Heidi?
the formula from the state is based on, they look at your per pupil over a period of time. It's a complicated formula. It's not quite as simple as what you were saying, Louis, but basically it changes every year. So like last year it was 4,800, and this year it's 5,670. So it uses the per pupil expenditure, but it is I mean, that's the number for this year. I had worked with Monique in finance to get it, and that's what the number is. Our per pupil went up pretty significantly last year, but still there's a pretty big difference between what we take in and what we spend.
Is our per pupil expenditure that's shown here, does that include federal dollars, or is that the local expenditure?
That's the total, everything.
Okay, so there should be a line on here that shows how much we get from the federal government too.
The FTE is what we get. That's what we get.
That's state money.
No,
So
that's
all the federal.
the full-time
designated.
equivalent.
Maybe you could share that. It's just so different from what we've seen in the past.
I don't think it's significantly different than what we've seen in the past. I think when we had lots more students, I mean, I think when we were at our height for enrollment, our per pupil had gone down to about $12,000, but then that's where we take the bite with the federal money, because you end up having to pay it back if your PPE goes too low. So we'll talk about that in the next slide, but there's sort of a happy medium that you have to look at. But at this time, we have gone down in students and way up in expenses. So that's why the difference is greater than maybe it's been, or it was maybe 6 or 7 years ago. But
That's fine. So I'll modify my thing and just say it's so different from my understanding of what I've been shown. I don't know, right or not. It's just that when we've discussed charging tuition,
It's closer to the actual cost of educating.
it was basically covering the local cost minus the local fair share. So I'm not saying that that's the way it is. I'm saying that's what I thought it was.
right.
If you could share the calculation, that'd be great.
And Lenita can probably get that for us. I think too that when we've presented the tuition money in the past, we haven't looked at the whole picture. And I think it is important to look at the whole picture because it's not worth it if you take in $60,000 for tuition, but then you lose 300,000 that you have to pay back because of the federal discrepancy.
So that just kind of leads into my question, which is like looking at the student enrollment numbers that we are seeing now compared to what we budgeted, what is the difference? What's the cost, so to speak, of the lost students not being?
About $1 million.
So our budget for next year is $1 million too high. We have well,
it depends if the students come back or not before the FTE count.
but right now, we are short $1 million because of that. So I feel like we need to be planning for that. And I know we're trying to recoup some of that by you're not filling some open positions. I'd be interested to know where we are from a budget point of view, because it could influence how I feel about whether or not we take students, but also this question, if we take students that are tuition, are we losing money by taking them? And I wonder, does it, I feel like it could matter, for example, if we're filling the 20th seat in a kindergarten classroom, the incremental cost to us could be lower than if we're having to hire a whole new kindergarten teacher because we took in 6 tuition students. So also, like, do we need to get a little bit more strategic and in the weeds on where we would and wouldn't fill in tuition students, because in some places it actually might be a cost benefit to us, or in other places, like if it caused us to need an additional learning cottage somewhere or hire another teacher, it wouldn't be worth it. And so I think we need to really, really think this through, understand the answer to Lewis's question and also my question, which is where are we from a budget point of view? Are there open positions, teachers that we have not hired yet, or positions that we can just not fill?
Yes, we've done together.
And
Sorry, can't hire.
And if so, how many positions was that? Because I know we had 3. And so where does that put us? Like, you know, like where are we from a budgetary standpoint of having to recoup or make adjustments or dip into our curve for that difference?
We're waiting to pull the specific numbers for what we see after July.
Yeah, and I understand. And I'd be interested also to know, just from years past, what's the typical bump we see, you know, right before school starts. And I also know we have also seen a bump of enrollment between August 1st and Labor Day. So what in a typical year could we expect to happen, knowing that this is also not a typical year?
Yeah. Heidi did pull that information for me. I don't have it in this presentation, but
Okay.
you have some more.
Will be
And-
very helpful. Thank you.
I can grab that again for next time, Maggie, but just from my memory, I mean, first of all, it's not a typical year, but we have seen a bump of 100 to 100 students over different years during this time. I don't know that we're going to see that this year.
And also,
Can I-
let me add that from a budgetary perspective, we did not include tuition from students that are not currently enrolled in our budget projections.
Juanita.
So let's talk a little bit about what are some of the positives, what are some of the costs. So positives, we fill empty seats. We've got, 38 seats open at Claremont. We open it up, we fill those seats. We offset some of that $15,000 so we can recoup about $8,000 of the $15,000 that it costs to educate a student here. So we're short, but only short $6,000 instead of short $15,000. We've planned for next year by hiring, so we pull in some of that money, but not all of it. It extends the experience of CSD to other families, adds students who want to be here. I keep getting a lot of, interest from the sports and athletics department about how it can enhance some of our sports teams. So those are some of the positives. And just, if you think of any other positives, I think we can talk about those when we get to the discussion point. Some of the considerations before we say we're gonna take tuition is, let's say in January, kids are vaccinated, parents love what they're seeing in our schools, all those kids come back to us. And we've taken an extra 38 kids at Claremont because we have those seats open. Now we have an extra 40 students at Claremont. Where do we put them in January when those 40 kids enroll? So that to me is a big concern, is we may see a quick turnaround on people coming back to our school system, and I'm very nervous about filling seats when we have current students out there that just are waiting to come back. Can we eat the cost a year to get us through when those students return to us in the following school year? We know that construction's continued. We know that houses are selling very quickly in Decatur. And they're still building more houses, more townhouses, more condominiums. Our class sizes are small enough right now in K2 that we can socially distance really well. So that's another, to me, big draw to keep our classes where they are. And this is where Heidi and maybe Francis can help with this tuition. This is something I had no idea about, but when you take tuition students, it lowers our per pupil expenditure. And this is something that they use to calculate a maintenance of effort in special education. So when that PPE goes down, how it compares to the norm or the number, and Heidi, this is where you may have to jump in and save me. There is an opportunity, there is a challenge where we may have to spend money to pay back the federal government to match that maintenance of effort. So
Right.
Heidi, I'll let you explain a little more detail.
So there's a requirement that we continue to maintain the same local effort in comparison to the flow through monies from IDEA and the federal monies that we get. And so when the per pupil expenditure is part of a formula that they use to figure out the maintenance of effort. And so when that number goes down and you compare it to what we're spending, they have already given us, let's say, $500,000 for special ed money. And if our maintenance of effort is not the same, we could have to pay back $300,000 from, for example, from our general fund. And so that has happened to us in my time here. I've seen that happen when we have made cuts or we've tried to be more efficient and we've, we're doing a great job, we've cut all this money, and then we end up owing it somewhere else. So I think we just need to consider that that's a factor. And we are in a little bit of a interesting time with that because we have lost students and we have increased expenditure. So we're coming in with a high PPE, so we just want to be careful to make sure that we consider that when we're thinking about this, because it may cost you way more than the money you take in for tuition. And I think, again, when we've looked at situations with tuition, if you need the students because you can't functionally run a classroom because you have less than 10 kids or something, it's good to take tuition because you need to run a classroom well. But you might be eating a cost for taking them depending on how the MOE formula works out. And Francis, you can add anything if I've missed something about that.
Yeah, no, what I wanted to add is that, maintenance of effort is a supplant test, and it's something that we're required to do every single year. And it's really about making sure that IDEA money is not the primary source for educating students with disabilities. It's an additional funding source to go above and beyond the state and local funds. So if we do not meet the maintenance of effort compliance requirement, the funds that are paid back to the state are from state and local money. They will be from general funds. So that's just something that we need to, always remember. Because right now, while the whole district enrollment may be looking low, always remember that we are always finding students with disabilities. That is a mandate of IDEA. We have to continuously be testing and locating these students and providing them services. And so it's, we have to be careful with how many students we're bringing in, because if we don't want to discriminate, we can't say, oh, we can take tuition students, but let's not bring the special ed, because we don't do that. That's discriminatory. So that would be another, important factor to remember, because like Heidi said, our maintenance of effort is set right now. It's fine. Let's not mess with it. So I just would not want to bring in a lot of students that then either, take up the places of kids that we would be automatically be finding through child find processes, and or, filling up segments of teachers that we would need definitely to serve those students.
I'm not following this. I agree with everything you just said in terms of we can't screen. What I don't understand is if we're being told on the one hand that if we take tuition students, we're going to be funding them and losing lots of money per student. So I don't understand how we get from the state statute about tuition to those numbers. We've already talked about that. But let's assume that that's right. Then our maintenance of effort would be going up, because these new students are going to require services. We're going to be funding it much more than we're getting paid in tuition, which means that we're spending more per student. It sounds to me like. So instead of showing that we're shirking on our local responsibility, we'd be showing increased maintenance of effort. I've understood the discussion. What am I missing? I don't see how our maintenance of effort goes down because we're taking students and not getting money for them.
Because when you add more students, you're dividing the same amount that we're spending across more kids. So even when you add as few as 50 students, you're dividing the total, your per pupil will go down a certain amount. And, again, it's a balancing act. How much of it is worth it in terms of to fill the seats? And I think sometimes it's worth it because you need to have full classes. Given the COVID and social distancing and all of that, all of the unknowns, it may not be as worth it. I think that we often have not dug that deeply into the whole picture of where funds come in and go out. We've just looked at what we net from the tuition and stopped there. But there are greater impacts. And so I think we want to be smart about it, because there have been several years where we've paid back large sums of money from IDEA. And that's not something that we've often sort of said. It's just like, oh, we got to do it. But that has happened many times.
Heidi, was that, and do you attribute that to, was that when we were collecting tuition for students? Like, is there a connection between having to repay the IDA and us collecting tuition?
Not specifically tuition, but increasing numbers by large amounts without increasing expenditure makes that per pupil go down. If we add 500 students and we don't add any teachers, then the per pupil is a lot less.
The other thing to consider is, how do we run the application process to ensure equal opportunity? We say, if you don't have you have to determine, like, if we are going to accept tuition, do we create requirements for tuition? Do we say, because of added services for students that may want to attend if they have an IEP or special needs? What are our, where do we draw the line on what we can accept and fund for tuition students, or do we not? And then what extra costs come with those students that have various needs and various special needs opportunities? And then how many spots do we open? Do we, because it's low right now in K2 and we're pretty much at capacity, middle school and up, actually 3 and up, do we just open up for K2 to fill those spots? How many spots do we open? And then if we open spots, will we have enough room for our current students that live within our school limits when they come back without adding modulars in the middle of January? So, and your comfort level with how many years do you allow this? So some options we have available that are outside of tuition that can increase some of our per pupil, increase some of our FTE funding without really exacerbating this whole MOU formula, is expand our courtesy tuition to half-time employees. So previously you had to be full-time to bring a child to City Schools of Decatur, so we could allow our people that work half-time and above to bring their students for courtesy. Also expanding our courtesy tuition option further with the City of Decatur employees. So right now we give Decatur City employees 10 spots. They use a lottery, they assign those spots. We could increase that, and that would increase the number of FTE students that we get. And, you know, when we get that FTE, we still have spots to fill, but then we can fill them, I think, with a more diverse group of people as well. So,
10 spots every year, 10 spots total?
10 spots total. When they open, then they do a lottery for people that want them.
But on those non-tuition options, it would still be the same dollar impact to us for that number.
We would then only get the FTE for the student. We would get that $2,600 for the student, not the extra tuition money.
I'm confused.
Oh.
I tried to ask this as follow-up to him. 2620 is lower than the FTE we received. It's capped because they live outside of the district. Is there some formula I'm missing?
No, Lanita, isn't our FTE amount from the state 2620?
It is 2620. This is Heidi. So the state does this tricky thing where they change that number. So, so it has been higher in years past. Several years ago, it was like 28 something. But yeah, they changed the number that equals 1 FTE, but this year it has been.
That's great.
So, just back to what you said, if we are looking at the non-tuition options, like number 1, expand the courtesy tuition option for part-time, I don't see how that helps our budget at all.
It helps it a little bit by bringing in the FTE for an empty seat.
But where you then are having to pay that $15,000 to educate that child, so it's a loss of $13,000.
It's still a loss,
So
yes.
there's no tuition even being paid.
It's a larger loss.
Right, it's a larger, yes.
So again, I just don't see how that helps our budgetary situation. I think, just from what I'm hearing, I'm not hearing any financial benefit from accepting the tuition students. Correct me if I'm wrong, but, and I see there's a risk because we do anticipate many of our students to come back, and we still are experiencing growth, albeit slower growth, with the exception of what happened during COVID. And when I was looking at that enrollment projection from Cooperative Strategies at the last board meeting, the 3rd through 5th grade upper elementaries were both in the 90-something% full. And so if we're talking about adding K through 2, that means they're going to be at the upper elementary in the next year, 2 and 3. And that's where we're talking about having to add learning outages. So I don't see how this is necessarily a good long-term decision, because my opinion on accepting a student isn't just for a year. I feel like if we're going to accept tuition students, my personal preference is that we would let them be CSD students for as long as they want to be, for educational reasons and social reasons, and meaning like they're our kids, not you're our kids for a year and then you're not anymore. I don't feel like that's in the best interest of the student. So I think I would prefer to look at options for how we can mitigate the costs by not filling the positions, and really understanding what is the cost impact to us. And because of our fund balance, can we, if we anticipate this only being a short-term problem, which is what it sounds like, meaning this year, and then we are rebounding after that, and we will also be able to make continued adjustments in staffing. I feel like this is a short-term problem, and we might be introducing a larger long-term problem by trying to fix it with tuition students.
I want that, because I don't know if you were still on the board, I mean, if you were on the board yet when we were still collecting tuition. Was it a thing, was it a problem in terms of?
No, it was not to my awareness. By the time I got on the board, it was phasing out because we were experiencing capacity problems. So it had been a practice because before I got on the board, maybe 10 years before I got on the board, there'd been issues, and so they were using it to fill seats. I'd never heard of any of these complications. We just didn't have room, and so we phased out that program. When we were moving to get the bond passed, it was discussed quite a bit, and I think you might remember some of this because you were involved in that we had the option, because at the time, the concern was that we were overbuilding, that we would have excess capacity. And what we said at the time was that if we have excess capacity, we can always fill those seats with tuition students. And so that's always a tool that's available to us. Recognizing that we couldn't collect the entire locally financed share, but that we could cover everything except for the 5%. That's why I'm not persuaded that these numbers are right. And what I'm hearing is a lot of resistance to the idea, and I don't really care if we take tuition students or not. There might be good reasons for running a school not to have them. I do think that we should get the financial analysis correct, and I'm not persuaded that we're not going to solve it tonight.
I don't have a dog in the fight either way. There is a financial argument for accepting them, even if they pay less than the total amount that we're paying for students, because 94% of what we pay a student is a sunk cost. It's school, salary, et cetera. If you have a senior class where there are only 10 students in every classroom, adding in 5 is an increase. So yes, get those numbers right, but there is an argument for filling it in if you know.
I would also, in terms of how you accept tuition students, I don't know the answer, but I don't know that we can do that. Like, I'm kind of opposed to extending it to half-time students because that's just a giant benefit. I just think we need to be smart about how we do it. I think those kind of benefits for full-time. That's my opinion. But anything we could do to extend the privilege of attending our schools to City of Decatur full-time employees, I would be in favor of. However, not as a giant loss to the system. So if these numbers are right, I'm not sure.
The difference there is that the City of Decatur employees are actually paying the tuition. The part-time employees would not be paying.
I think, well, we could just open it up to tuition for city schools, city employees. But here we're talking about just doing extended. So we would just.
Oh, the 10 spots for courtesy. Yeah, just the current 10 spots for courtesy.
Oh, they're not paying tuition? It says expand tuition options to City of Decatur.
Non-tuition options. Should have.
Oh, okay, well, that makes a difference. I just think it really comes down to numbers, so we have to answer that question. But I don't see why numbers. One being, we absolutely can't do it if it's a loss for students, but also the more, like, to what James is talking about, if it exceeds capacity at a point where we're starting to incur more capital expenses or having to hire more teachers, then also that would make it a non-starter.
That would be an issue that we may not see until the upper elementary, though. Right? That wouldn't be an issue you would see in kindergarten potentially. But when, a couple years from now, there are cottages because of the student and the other students that came back. I'm kind of leaning toward what you were saying of if we try to fix this potentially short-term issue, it could cause some long-term issues down the line with it. Just, tough it out for this year.
Certainly sounds like we should just tough it out, table it, come back to this in some, no enthusiasm to do it, so be it.
and it still doesn't seem to bring the benefits that we were, you know, hoping that it could, and then especially by your survey, seeing that there is still a good portion of families that are going to come back. So maybe this is something we look at in another year if we have the same, maybe differently.
I was thinking about our, past projections, like last year, we were like looking at 5-year projections and enrollment was going down.
The growth was going down. I don't think enrollment was going down. So enrollment,
It was flat, I think.
I think we need to look at that again, but I think that the rate of growth was slowing, but enrollment, actual numbers was not going down.
So there were two,
It was growing more slowly.
yeah, there were two graphs. So graph charts. The one chart was the scientific, what cooperative strategy said, hey, here's what we think is going to happen with your enrollment. And then they brought that data to the upper levels of leadership, and they said, we don't think that's accurate because we know even though there's not a lot of students born in our school system, people move in with currently aged students that they move in to come to us for kindergarten. So the thought was, let's look at a modified, kind of hold the kindergarten numbers the same for that new projection. So that, there were two. So one did show like, hey, we'll probably have a little bit of a decrease, and the other one was, no, let's hold those kindergarten numbers steady around 4 something, because that's what we have, and that's what we've had for several years, and we think that we'll keep those numbers. And that one kept kind of a steady up. So it sounds like we don't want to move this forward to an action item. All right, so the next item on the agenda is the residency homeowners. So Lewis had mentioned at the previous board meeting that we should look at creating a policy or some language around people that live in our school system that have to renovate their homes and possibly be renting a house that may not be in city schools of Decatur attendance zone while they are renovating. So added some language to our, we actually have it's not a board policy, we just, we have been added some language there. Carrie gave some input as well, that I haven't reviewed her input. I sent it to her this afternoon. So any comments on that language? It basically says, if you have to move outside of your house during a renovation and you rent something outside of the city limits, we're gonna check, we'll say that's fine, we'll check your residency on a monthly basis just to check in and say, hey, are you still planning, you've gotta provide some updates on, yes, I'm still planning on returning to my home, you're still paying taxes for that house, and you're now in a temporary rental while you're renovating. So I think we just add that language to that policy, that administrative regulation. We're okay with that.
I'm fine with this. I have a couple of thoughts. I would clarify on page 4 that it probably does put transportation for non-resident, temporary non-resident.
Mm-hmm.
I don't think the system should be under any obligation to
Right.
provide busing to that. And language we used in there was different. It was temporarily displaced tuition students. Would probably be worth it. Do we say no subletting of the place? Do we want
Oh,
to?
absolutely. I think it should be. you
Not in there.
continue- It's not in
Yeah.
there. I think it
Yeah.
should say you continue to own the home.
Main residence.
You can, yeah, right. So you own the home that you're saying you're gonna move back into, you continue to pay taxes on it, you don't generate any income from it.
And no, so, and I think there needs to be verification that no students are enrolled from that address that are not that family students. Because I know that it has happened in the past, that there's been subletting and there's been, you know, just ways people have been trying to get around our rules. I think it needs to be very, very strictly enforced.
And they should sign something to let them, because they're gonna have to come, the good news is that they would have to come and declare what they're doing. So they should have to sign a thing acknowledging the rules. And sort of, they're on the radar and sort of verify everything.
I think that you said there's a time limit. Is there a time limit for how long this can go on?
We would probably, I didn't put a time limit in there, but, just as we were talking about it, we were thinking not letting it, like, if it expands over a year, couldn't do over a year.
That seems.
Construction usually,
Yeah.
usually in a year.
Usually 6 months is,
Yeah.
Right, well, we will fine tune that and update that administrative regulation. And then the last item for the board meeting tonight was just making sure that the board has had a chance to look at the procedures we're gonna put in place for, meetings. So for July, planning on coming back in person, but still broadcasting via Zoom for families that want to watch at home. We would ask anyone who wanted to attend the meeting to pre-register. We could open the registration form up 24 hours in advance for people to sign up, but also have a QR code for people to scan if they come in. We would set a limit. We haven't calculated the number yet because I want to space the chairs out and see how many we can fit, and then we'll set that number. People would have to agree to wear a mask if they're not vaccinated. They would be come first serve, first space, first come, first serve. However many people, once we hit capacity, we're at capacity. If they want to sign up for public comment, they can. Now, here's one of the things. I'm okay with them doing public comment in person or via Zoom. Doesn't matter to me. Does the board have any feelings on that, one way or the other? They would still have to sign up, and when they sign up, we would adjust the sign-up form to say, I'm going to be in person or anticipate being on Zoom. That way we would know. And then they'd also have to sign, check off that they agree if they're unvaccinated to wear a mask while in our facilities. But if we're, looking at continuing with our masking protocols as they currently stand, we would probably say masking is regardless of vaccination or not.
My only thing about comment, I think it would be a mistake to not let people comment by Zoom.
Oh, I'm fine with it, yeah.
I also don't like not being able to see people when they're commenting. I feel like we need to arrange for the camera to be on so that we can see.
Hear that, Shana? Okay, thank you. We can do that. Any other questions? Does that sound good protocol? Awesome. That wraps up our work session for tonight.
That was really good preparation. Thank you.
We are adjourned, 8:42.
Natasha, good night, everyone.
Everybody.